Hi everyone, today I'm back with the second episode of season 2, and today we're trying this new vertical layout. Thank you, Dolce. Yeah, but we'll see how this goes, but we're gonna first try this vertical setup. Today I'm gonna talk a little bit about acne. So tell me if you have problems with acne, tell me, do you guys have problems with acne? If you have problems with acne, you're not alone. Everyone has problems with acne. And yeah, so why does acne occur? First, hormones, obviously, you guys know, especially girls, at certain time of the month, your skin just kind of flips out and does not cooperate with you. Secondly, it's genetical. So if you guys have if your bad cystic acne, see, if you guys have parents that have acne or have, records of having acne, it's more likely that you have acne. And clogged pores due to sweat, oil, dead skin, or sebum. So it's lack of exfoliation. Just having your pores clogged up and your skin cells just piling on top of it could cause acne. Changing weather and environment. So just that adjusting period between seasons and weathers, between weathers, your skin can break out due to the change in temperature or, humidity levels. And makeup and other irritants. So certain makeup products could cause acne, could contain acne-causing products and acne-causing ingredients. And yeah, so these are the possible reasons as to why you guys could get acne. So the type of acne and the characteristics, or how to differentiate the causes or the different types is, so first of all, not all acne is the same because of the reasons why I just listed. If you're getting it from hormones or if you're getting it from genetics, they're basically all different. And this is how to tell them apart. First off, whiteheads. So this is the most common type of acne, and this is caused by blocked pores. So these are the ones you get around your nose, on your chin, or on your T-zone area where you can kind of visibly see your pores the best. And papules and pustules, and I think I'm pronouncing something wrong, papules, which is slightly more inflamed than raised bumps and usually painful on the touch. So when you first get pimples and you touch them, you're okay, I should not be touching that because that hurts. That's when Hi 대표님. Yeah. Cystic acne, which is occurs when there's a severe infection of bacteria clogging the pore. The severe form of acne, so those really inflamed and yellow and red and I am the daejang of acne, kind of acne looking people things. Yeah, they're large in size and highly inflamed, usually deep in the skin and are hard to remove, and high chance of scarring if dealt with at home. So it's mostly recommended to, you should go check out a dermatologist or something. So yeah, there are different methods, and especially with acne, it's really important to care for it the right way. And there are a lot of different ways to take care of it. And we know that everyone gets the urge to squeeze it, even though you're never supposed to squeeze your spots. So, because I can't leave it alone. Whenever I get acne, I'm just my hands right there, no. So, what do? There is in fact a correct way to squeeze your acne or get rid of your, I hope you don't make a rap song about acne. Ha ha ha. Yeah. Okay. Whiteheads, pustules, or papules, these don't go away naturally. We either 1, squeeze them, or 2, let them pop on their own. But squeezing them the wrong way without the proper aftercare can lead to scarring or further infection or even enlarging of pores. That's something I've known. So here's how you should care for them. What you need are compressed cotton pads. 갑자기 왜 이렇게 사람이 많아지지? 여드름에 대한 관심 많으시군요. 네. Gina, do I open this?
Yeah.
Because it's yours,
No, you can.
Sorry, guys. I love teasing Gina. Why are there 50 of you guys today? What's up? What's happening? Well,
it's acne.
What's
widespread problem?
Yay! I mean, no, that's not a good thing. So, get a compressed cotton pad, toner, blue cream, rubbing alcohol, pretend like I have it, and a pimple extruder. So pimple extruders are usually really there's 62 people. What the heck?
Thank you.
Yeah, we're having a little breakdown over here. But pimple extruders are those little metal bar sort of things with like circles on the ends that like are stainless, and you just kind of use them to extrude out your pimples. So how to wipe the infected area and the extruder with disinfectant alcohol. This is very important because you don't want to like infect your thing and turn it into cystic acne. Second, use the pointed end of the extruder to lightly puncture the spot. Squeeze with the hooked end until the small collection of sebum comes out of your acne thing. And a tip to remember is that if the spot doesn't squeeze fully in 1 or 2 attempts, just leave it and allow for, there's 72, what the heck? Okay, allow it to just kind of mature. And you know how when you're in Korean, they like use this term like when your 여드름 익어s, which is kind of like gross, but it's like basically saying your pimple ripens, and you wait till it's like the perfect state to like squeeze and stuff, and you just give it some time, because if you try and like busting it out when it's not ready to leave your skin, it's just gonna be like, I'm not gonna go, and you're just gonna get a big red bump on your face. So now that we know the correct way to squeeze the spots, what else can we do? So aftercare is important, and the biggest thing is to prevent the squeeze spot from developing further irritation and from scarring. So acne scars suck. Like getting acne scars suck because first, they give you hyperpigmentation, which you can never really get rid of. Second, scarring is a lot harder to remove than acne. Like acne, if you just leave by itself, you know, it eventually goes away if you, properly cleanse. Okay, it's not happening. But scarring doesn't. So yeah, for this, the Midnight Blue Cream is great. So I've talked about this product a lot, but anyways, it's formulated with guanidine. It's a natural extract of chamomile oil that's used in burn medication and other soothing ointments. And it can be used directly on top of freshly squeezed spots, so like it won't irritate it in any way. And it prevents the area from remaining red, inflamed, and sensitive. And it should reduce any swelling overnight. So if you squeeze the pimple and you have something the next day, if you keep this on, it'll kind of reduce swelling. But the best thing we can do is, prevent the acne in the first place. So preventing acne means basically cleansing and exfoliating really well, and moisturizing to prevent it, dry skin cells from piling, and preventing dirt and all that sebum from escaping your skin. So cleansing removes all the dirt and oil and grime that can cause bacterial infections in the skin. And exfoliation keeps the skin surface free of excess sebum, oil, and dead skin that may clog pores. Moisture, whatever skin type you are, moisture is key. Keeping the skin hydrated is crucial in, keeping it from accumulating dead skin and allowing it to continue cell turnover and regeneration. So let's talk about a routine that can keep your skin healthy and ready to fight any unwanted spots. So we're back at 35. Thank you guys for joining in the live again, even though we kind of the older post kind of blew up. So yeah, first, cleansing is key. If you wear makeup, use the double cleanse method. It's pretty self-explanatory from the name, which means you have to cleanse twice. So gentle black deep cleansing oil wipes away all the sweat, oil, and makeup, nourishes the skin with its various essential oils, and it's really important to use a cleansing oil if you wear heavy makeup, because you really need it to emulsify all that makeup within your pores and everything, and let it go away first before you go in with foam cleanser or soap or whatever you use as your regular cleansing routine. And rich moist foaming cleanser, which has a low pH for foaming cleanser and cleanses remaining oil, balances the skin's pH, and gentle bubbles don't irritate the skin. So cleansing your skin twice is really important to get rid of any excess dirt or sebum, but cleansing your skin twice can irritate it if the cleansing routine is a little too harsh. So using a low pH cleanser like this can be very effective in kind of gently removing all that stuff you want to get rid of. Yeah. So exfoliate gently with a physical or chemical exfoliator. So chemical exfoliators would be like the AHA, BHA stuff. But depending on your skin type, you can use this is the Gentle Black Sugar Facial Polish, which is great in clearing out pores and just physically removing a layer of dead skin and sebum. And for me, these sort of scrubs are the most visibly effective in my opinion. Like just like blackheads and whiteheads around the nose and that like T-zone area and stuff. Using scrubs helps like kind of get rid of like the top surface and just kind of like 깨끗하게 이렇게, yeah, get rid of that. And freshly juiced vitamin drop, which contains 5% pure vitamin C to naturally brighten the skin, even out skin tone, and fight and care for pigmentation. And it gently exfoliates skin. So this isn't made to be like an exfoliator, but it has like an exfoliating kind of agent to it that helps chemically exfoliate. But I think if you're truly going to like religiously depend on a product to exfoliate, this shouldn't be it. It should be more on the physical side. This is just me though. If you have really sensitive skin, go for the chemical exfoliation. So it can be from a toner or from like a serum like this. It's really up to you. Moisturize with a selection of mild products that won't further irritate the skin, and just plain hydration in general. So something that you guys might be confused is 피부 좋아지려면, if I want to have good skin, I'm gonna like put on this like eye cream and this essence and this like serum and like toner and lotion and 수분 cream and all this stuff, but that's like your highway towards like 여드름 people. Like, it's not the smart thing to do. What you need to do is kind of like simplify your moisturization routine, but really get it hydrated. So use like, for example, use a good toner with a compressed cotton pad, and this helps just give like an even texture to your skin and light layer of hydration. So I have the Supple Preparation Facial Toner here and the compressed facial cotton pad. And just get a little bit, enough to just soak it up and wipe across the surface of your skin after you cleanse. And after that, go in with like a serum. So another moisturizing serum that is pretty mild and soft on your skin. So this is the Rich Moist Soothing Serum. And these all just kind of work hand in hand together. They even smell similar in my opinion. And then Rich Moist Soothing Serum, which is oil-free for deep hydration that leaves complexion balanced in terms of hydration. Now, oil-free is important in terms of preventing cystic acne, but I'm not saying that all oil like containing products are bad. So like, I don't want you guys to get that confused. A lot of people with acne tend to like steer towards products that are oil-free, but your skin should not be completely oil-free. It needs to have like a good moisture and oil balance, but you just need products that help maintain that balance, like so that you're not like a grease ball or you're not like a desert, you know what I mean? And using products like this that are mild but gets the hydration done helps keep that balance going. Yeah. So treat with a soothing cream like the Midnight Blue Calming Cream. Again, like I said, this contains guanacine, which I probably said to you guys like 75,000 times, but I'm mentioning it again because it says it here. And it has like, it's a natural extract from chamomile. And yeah, so burn patients, basically, if you think of a burn, your skin is exposed and you blister, and basically your skin is very inflamed and irritated and red. And just the fact that this chemical or this substance is suitable to just put on top of it just shows how this helps with de-swelling or like reducing irritation. And this chemical is apparently in treatment ointments. What? Treating ointments? Treatment ointments. What the heck is that? Treatment ointment. Treatment ointment. That just sounds so weird in my mouth. Anyways, treatment ointments. So yeah, it definitely helps with soothing and calming, and apply as a spot treatment. So even if you like have like a thin light layer all over your face, if you have like a special spot or like a big pimple that you want to focus on reducing swelling or anything, you could use this as a spot treatment as well. And geez, yeah. Yeah, and also this can help acne in its starting stages. So when you feel like, okay, like you know that feeling when you're middle of class and you feel that tingling like in like the corner of your face, you're like 망했다, like okay, I feel like acne coming, like 여기 여드름 100% 나겠다, and you go home and you're just like, okay, it's right there, it's right there. When that happens, before you let it like turn into like a huge like pimple and burst open, use something like this. Like use something that can like calm it down and just let it relax a little bit before it turns into like a monster. And last but not least, if it further develops, we recommend that you take the steps we listed above, which is basically Gina writing all this down. Yeah. So, tips to prevent acne. Before we go, here are some lifestyle tips that we recommend to prevent acne for you. So, again, these are more things that you could implement within your lifestyle to prevent breakouts. First, maintaining a proper skincare routine. Proper care for your skin is key in preventing the formation of acne, which is what we want rather than tackling acne when it arrives. Like, it's better to prevent it. And for this, always cleanse thoroughly and exfoliate. And I am getting redundant. Okay, second, I'm sure you've heard about this all over the place. 진짜, like even in health class. Drink lots of water and eat fresh foods, and this is something that I am very bad at. I never drink enough water, and living by myself, like eating fresh vegetables and fresh fruits, like impossible. So I would recommend, like if that's the case for you, like even go as far as just try and take like vitamin supplements or something that could help, include that vitamin within your system. And drinking a lot of water is, I think, something you really need to get like conscious of. Like you just have to like be aware of it and avoid soju. Ha ha ha. Another thing, by the way, this is a really random thing. I don't know why I'm getting sidetracked, but since I don't have a lot left, I think I have like a minute to get sidetracked. So, certain people after they go drinking, their skin gets a lot better. And then certain people, when they go drinking, their skin breaks out. What's the case for you guys? I mean, like, I don't know, like my friend says like when she wakes up in the morning after drinking, her face is like glowing, and my other friend's like, oh my god, I drink and I have like 5 pimples on my forehead. So I think it really has to do with like how your liver and everything metabolizes that alcohol and everything, but I'm not sure. Okay, anyways, change your bed sheets regularly. So if you think about it, you change your clothes every day. Why wouldn't you think of changing your bed sheets? You're like, your hair and like your grease is like all over the place, like 계속 이러고 있는 건데, you're just basically rubbing that on your face. Like, 여드름 만들어주세요, Wash your bed sheets regularly, okay? And tie your hair when you're at home. 근데 this, I don't know who wrote this down, but 저는 이거 약간 반대합니다. Cause guys, like tying up your hair for a long time is actually really bad for your circulation. 이거 약간 두피에도 안 좋고 for your hairlines, and like in terms of if you have like a lot of hair loss, in like hair care wise, this is bad. Maybe for your skin it's better because you're getting all the hair out of your face, but if you're like getting a bald spot or something, don't do this because your hair's just gonna fall off. But if you're concerned with a lot of cystic acne, getting hair out of your face, like maybe with a headband and stuff, is very effective. Okay, clean your phone screen on a daily basis. Guys, this is such it's such a pet peeve for me. After you're on the phone with your like friend and then you look and there's like this like greasetopia on your phone screen, and 이거 진짜 약간 기름종이처럼, it looks like oil paper. I think that's disgusting. And then you kind of forget about it. That's just going all over the place. So, oh my god, ew, I hate that. Yeah, I know, right? So you guys just rub it off, or just, I of course home, like get like cotton pads with like rubbing alcohol and just kind of like rub the phone screen a little bit. Last but not least, wash your hands frequently, and before you wash your hands, refrain from touching your face throughout the day. So if you think about it, even just now, just throughout this live, I've touched my face like 2 million times. So think about all that germs, like just from touching all this like equipment over here and being like, hi Gina, and like, whoa, ho, ho, and like, oh, 얼굴에, yeah, bacteria. No. Wash your hands before you touch your face, and try to like kind of not get into the habit of doing this very often, because if you think about it, you're basically putting germs on your face, and I just did it again like 3 times. So, most importantly, don't be stressed, because this causes unwanted spots. Just keep sticking to your routine and make small changes for improved skin, which is something that I'm sure all of you guys know. I'm just restating it for you. Another thing that's really important is getting a good night's sleep, because I think it's really important. Like, stress, all that aside, not getting sleep is so like bad for your skin. I just feel that personally. When I don't get enough sleep, my skin's just like, why are you doing this to me? Like, 너 나한테 왜 이래? 잠 좀 자. And then my skin, like after I get like 10 hours of sleep, it's like, you know when you 낮잠 자, like when you take a nap and then like you look in the mirror and you're just like, oh, okay, my skin looks like it's like blurred out to perfection. Yeah, that's probably because of the rest you're getting. So give your skin its rest. And we also know that summer's coming up, and a lot of you are worrying about body acne. So like in the chest, back, and some people even have it on their arms. While we want to stay here all day to talk about it, we are going to prepare a special session. We, meaning Gina and the staff here, we're going to prepare a session all about body care soon. So please look out for that. And Kasper will be here to tell you how to get rid of all the body acne that you have. So yeah, I'm going to breathe because it says that's all for today, but I don't want to end it like this. Soon, good luck this weekend. By the way, my show me the money thing is like tomorrow. Wish me luck, guys. Wish me luck. Yeah. Should I wrap it? No, that's not gonna happen. Yeah. So that's all I have for today. Please leave any thoughts and suggestions. Even after the live ends, the staff always checks the comments that you guys leave. So give us suggestions if you have ideas. And yeah, we went with the purple background again today, but this whole like purple, orange, green mixture is just not clicking with me. So yeah, I'm like kind of 눈치 조ing Gina, like 다음 주 다른 색깔, you know. I don't know what's gonna happen, but I hope you like the live session today, and thank you for watching.